Good evening, all. Welcome to Lighted Red podcast series, a joint initiative by NATCO and Voice of Healthcare. So, when come to Lighted Red, it's a podcast platform dedicated to spreading awareness, sharing stories, and bringing hope to everyone who has impacted by blood cancer. You all know every year millions of people around the world are diagnosed with conditions like leukemia, lymphoma, and myeloma. Yet, too often, signs and symptoms have been ignored. So today we have Dr. Ketan, a renowned medical oncologist and senior consultant from Fortis Hospital, Mohali, to understand and explore what actually blood cancer means. And also he will share his insights, knowledge on diagnosis, treatment in blood cancer. Anyways, he's with us. So as we explore our multidisciplinary care and clinical research and shaping the treatment shaping in future of the blood cancer therapy. And it's always honored, sir. Welcome you, sir, to this platform, Lighted Red platform of blood cancer awareness. Over to you, sir.
Hello, namaskar. Good evening, namaste, everyone.
Okay.
Thank you, dear. Thank you for this invitation. And thank you for this opportunity to discuss with the public this most important aspect, that is blood cancer. As you know, right from the era of the 70s movies, blood cancer had a fear. In fact, the word cancer overall had a fear, and people thought that isko blood cancer ho gaya ya cancer ho gaya, so life is over. So today we will discuss all your the questions that commonly come to your mind. What is blood cancer? What are types of blood cancer? What are the treatments, upcoming treatments? What is the hope? What are the support groups? We'll discuss everything. So welcome everybody on board, and yes, please ask your questions.
Thank you, sir, once again. So when we talk about this blood cancer, actually, what is blood cancer, sir, and how different is it is from other types of cancer?
Yes. So blood is a fluid flowing through our blood vessels. So naturally, this cannot be like a solid tumor like a breast cancer or a cancer. It is naturally very different because it is circulating in our body. Blood cancer overall is a general term for three broad types of cancers. One is the leukemias, that is the cancers of the white cells. White cell cancers can again be having a very quick, rapid course like acute leukemias, or they can be having a long-term course where they stay in the body, but we control them for a very long time. That is chronic leukemias. Apart from this cancer of white cells, that is leukemias, we have the lymph nodes in our body, the spleen, and the lymphatics, that is the lymphatic system. So any cancer that affects this organs, that is lymphoma, this is also a kind of blood malignancy. We can say this is grouped in it. So this is a different kind of malignancy which we call lymphoma. Lymphoma again can be non-Hodgkin and Hodgkin lymphoma, as you would have commonly heard. The good news is that most of the lymphomas have very good treatment. Then the third element, the third component of blood cancers is myeloma, that you will have heard, or we call it multiple myeloma. So this is a specific kind of cells in our bone marrow, that is the plasma cells. They start growing and they start producing a protein and antibodies. They damage our kidneys, bones, lower our blood levels. So this is another type of blood cancer. So majorly for the public, to understand, it is a three uh, types of tumors, that is lymphomas, leukemias, and myelomas, that we overall constitute as blood cancers.
Okay, sir. So it is white blood cell cancer is leukemia, and lymphatic lesion
Leukemias,
cancer is
yes.
lymphoma, and
Yes, and
plasma cell
plasma
cancer
cell
is myeloma. Thank you, sir.
multiple myeloma.
Okay, sir. And who are the general people who are generally at risk of developing this type of blood cancer?
So actually, there is no age bar. In fact, even in children, we see leukemias. For example, ALL, acute leukemias, are very common, mostly in the children. So these blood cancers can start from any age group, including the children, young adults, adults, and old age. In old age, we often see multiple myeloma or lymphomas. Lymphomas again can occur in young adults as well as in young adults, adolescent children, and even in the old age. So age is no bar. In fact, it can start even from very young children, mostly acute leukemias or some other rare form of cancers. But the good news is that most blood cancers in children are usually curable.
Okay. Okay. So to understand the burden of this cancer, sir, what trends you see in the incidence of this blood cancer? It is rising in India, or how far it is developing, sir? The incidence.
Yes. The incidence is mainly rising as such in general of all cancers. In India, the incidence is rising. Maybe that is because of the pollution, the chemical, the diet, the lack of exercise, the smoking, alcohol addiction. Cancer is in general overall on the rise, but in the blood cancers, lymphomas are rising much more than leukemias. That is what we are seeing today. And in general, we also are now testing people more frequently. People are getting tested by themselves. Even a simple blood test can give an idea of the leukemias. So now testing has also increased. So we have more knowledge. Tests have become more advanced. And even in the tier three cities and the rural areas, people often get tested because they are more aware. So in general, testing has increased, diagnosis has increased, and also cancers are on the rise.
Okay. Anyways, you discussed about these points and about the age distribution, but still, what kind of gender, or it may be male or female? So how does it is distributed among the patients? Age distribution.
So actually, it affects both genders, but in general, we can say that slightly more common in males. That is there that in males, the incidence of cancers overall and blood cancers in particular is slightly higher compared to females, but that is no hard and fast rule. Any of these diseases that I am discussing, that we are going to discuss in detail, they happen in both of them, males and females, although slightly more common in males.
Okay. And when we talk about the risk factors, sir, is there any lesser known risk factors, sir? Any people may ignore commonly? What could any,
Yes.
sir?
So, yeah, apart from increasing age, with age, our defense system becomes weak. We
Hmm.
cannot fight with the incoming diseases, the cancers and infections like we used to fight in our young age. So definitely age is one of the widely known risk factors for any cancer. Although even in this, we know that young children can get affected by cancers, for example, ALL. So age is not a absolute risk factor. Apart from that, what commonly people know is smoking, alcohol, and sometimes people have received radiation either for some treatment of some other cancer, or they have received certain chemotherapies that damage your DNA, and after few years, you get a cancer. Apart from that, there are certain viral infections like HTLV virus, EBV virus. They are the lesser known factors, as you asked, which can lead to blood cancers overall. So the lesser known causes include high doses of radiation, sometimes of chemo that you have received earlier for some other cancer, or sometimes of oral medications, for example, lenalidomide that you have received for some other disease. So these can also lead to second blood cancers apart
Hmm.
from chemical exposure, radiation exposure, chemicals like benzene, paint industries, where there is a lot of exposure to chemicals, asbestos, they all lead to cancers apart from the usual one. And then what I talked about is certain viral infections that can also lead to. cancers.
So three things, sir. One is earlier chemotherapy. Uh, the other is occupational exposure. Also, you covered, and the third is what you are saying is that, sir. One more thing is this
Radiotherapy, viral.
radiotherapy and all those things. That is what, sir. It really triggers the blood cancer. So that is what the third point when you said the radiotherapy and all those things. They really trigger the
Yes,
blood cancer. Okay.
yes, because what they do, radiation therapy damages our DNA. Now it is our
Okay.
body's duty to repair it. And sometimes we are not able to repair it properly. And that leads to faulty division of the cells. And that is what predisposes them to cancer.
And second point, you talked about chemotherapy, sir. The one person who has taken early chemotherapy, that also damages the DNA. Mean to say
Yes,
the
very right.
cancer, the already is affected with other type of cancer, not only the blood, any type of cancer, organ related,
Yes,
and that can yes, sir.
yes.
Okay,
So, for example,
okay.
for example, a lady had breast cancer and she received
Mhm.
the typical chemotherapy, for example, doxorubicin for to treat her breast cancer. And after several years, because of the accumulated DNA damage, rarely she is found to have another form of cancer, maybe a blood cancer. So we usually relate that with the previous chemotherapy that was given.
Yeah, okay, sir. When we talk about this early diagnosis and screening, sir, is early detection is so crucial in blood cancer, sir?
Yes, because blood cancers, if are acute, they have a very stormy course. There are certain cancers that are acute that will make you sick in weeks, whereas there are other cancers like chronic leukemias like CML, chronic myeloid leukemia, chronic lymphoid leukemia, CLL, or multiple myeloma. They may take several months to cause you symptoms and trouble that you will visit your doctor and you will get checked. But there are
Mhm.
certain cancers like acute leukemias, they will suddenly present with either an infection or high-grade fever or bone pains or bleeding gums. So these or even kidney failure can happen because of the tumor lysis that is happening, or sometimes a lot of breathing difficulty if the cancer cells choke your lungs. So in such cases, the cancer will present very early. So it is very important not to ignore these symptoms and get yourself checked with simple blood test and visiting your nearest doctor as early as possible. What you asked regarding screening. So what is screening? Screening means that the patient is going to develop a cancer. We detect it early before the onset of symptoms. अभी उसको बीमारी का कोई symptom नहीं आया and we
Mhm.
are going to screen the patient for cancer. Unfortunately, blood cancer sometimes comes so quickly that even if you get a screening test done, maybe say once in a year, this cancer can come in just few months and it can be missed. That is what commonly happens.
Okay, okay. So, as you said, this early, whatever the signs and symptoms are really warning signs, and
Yes,
this
yes,
screening is
warning
also very
signs.
crucial. Okay, sir. Anyway, the next part would be the treatment and innovation, sir. How has the treatment landscape has been evolved in last 10 years? Because you have so much expertise, so please tell us that some insights, sir. How is the treatment landscape in the last
Yes,
decade?
definitely the last 10 years, a lot of hope has come up. This is because not only we have improved upon the diagnosis of blood cancers, we have improved upon the treatments of blood cancers, and we have not only improved upon the cancer therapies, but also on the supportive treatments for blood cancers. In these last 10 years, regional cancer centers have come up in many cities of India. Tier 2 cities now have decent cancer facilities to treat such cancers. So definitely the last decade has been a total game changer and a very good news for our public and our patients. For example, when we come to diagnosis, now advanced techniques like flow cytometry are easily available in tier 2 cities. Gene tests, genetic studies, and risk stratification, and all types of diagnostic gene testing is easily available. You can even uh, have good doctors there in tier 2 studies who can diagnose these cancers for you. Then the therapies that have come up now, not only the not only the chemotherapies that you have heard of that lead to a lot of pain, hair loss, vomiting, etc., that all people know. Now we have several target therapies and immunotherapies and very exciting new treatments that have come up for blood cancer. For example, now we have certain tablets that can target that particular gene. For example, for FLT3 gene, there is a tablet. For a particular mutation, IDH mutation, a tablet is now available. So there are several tablets that if that gene is detected in you in blood cancer, that can help to control the disease quite well. Then there are drugs like immune checkpoint inhibitors that have come available for especially for lymphomas like Hodgkin lymphoma, where they increase their own body's immunity and make it fight against the cancer. These drugs are, for example, nivolumab, pembrolizumab. They have become available and they are very effective in treating diseases like Hodgkin lymphoma. Then special new antibodies combined with chemo that we call antibody drug conjugates like brentuximab that have become available that are highly effective. Even in relapse cases, they are very effective in controlling the disease. Then stem cell transplant, which we originally called bone marrow transplant, that in the last 10 years has been happening from the peripheral blood. You now not need to take the patient to the operation theater and extract their bone marrow, which is very painful. You can simply do the peripheral blood from the veins. You can do the stem cell transplant. And even in stem cell transplant, the techniques have improved much, much now. Now there are better qualities of machines available to take out the stem cells and to manage the side effects of the stem cell treatments. There are very advanced medicines now available and the results have improved. Then CAR T cell therapy is a very exciting therapy. CAR T cell therapy means chimeric antigen receptor, T cell receptor therapy, where you take your patient's T cells, put them in the lab, modify them to hit back the disease, and then cells are returned to the patient. So this is one of the most exciting advancements that has occurred in the last just few years, not even a decade. And this can work very well in heavily treated and relapsed blood cancers like leukemias, myelomas, or lymphomas. The results are improving. And this is even now started to be available in tier 2 cities like Chandigarh also. So this CAR T cell therapy is a very exciting new treatment that has come up and that is getting more and more widely available. In fact, it is being researched not only in blood cancers but in solid cancers also. Doctors are now researching whether it can work well or not. And apart from treatment and diagnosis, we have now supporting medicines, good medicines to raise your hemoglobin, platelets whenever required. Supportive care treatment, new and new antibiotics, antifungals have become available, and medicines to manage kidney failure have become available. So the treatment has improved in all three branches: diagnosis, treatment, as well as the management of complications. So this last decade has been very exciting for the treatment of cancers overall and blood cancers in particular.
So the way you have explained really gives a boost or boost the confidence of the general public. So much evolution has been happened when you talk about immunotherapy, targeted therapy, and stem cells transplantation taking from peripherally, and also you're talking about CAR T cell therapy, which your own cells are going to fight, and you have to incubate them and again inject them. This is really exciting to hear, sir. And when these many therapies are available, sir, how does you personalize the treatment for different blood cancers, sir?
So
A
now
common.
the treatment of cancers is no more one size fits all. No, we doctors are your tailors, I would say.
Mm.
So we tailor the treatment for the specific patient depending on the severity of the disease, the genetic factors of this disease that have come up that help us decide how aggressive this disease is. We do all sorts of genetic and molecular tests on the cancer to know what type of cancer and will it uh, always require a bone marrow transplant or a stem cell transplant, or is it a low risk disease that we can simply cure with chemotherapy. So every case is treated in its own personalized way. And we have a thorough discussion with what type of cancer, what are the risks, and what medicine will suit, and patient is fit or not fit for that type of treatment or not. So it's a personalized approach. And in fact, we go one step further ahead that we also plan that in case this patient relapses, then what to do? Then what will be the next best line of treatment? So the entire treatment is like a flow chart, which we carefully design for that patient, depending on the type of cancer they have, the severity of cancer they have, their age and fitness status, and what treatments are there available. So it's a complex decision, and it is no more just chemo diya or yeah, this is your treatment and this is the last treatment. No, it has changed, and we go in great depths to decide the particular treatment for that patient.
Okay, sir. You explained very clearly, sir. But in India, when we talk about all those things, treatment, diagnostics, and managing with supportive care, there is one point will trigger, sir, because India is how far it is accessible and affordability. So this is the point which always triggers. So, is
Yes,
that
yeah.
these treatments are accessible, sir, affordable? Not only treatment, diagnostic tests. So, how far they are accessible, sir?
Definitely, I agree with you that cost is a big issue.
Mm,
Whatever the new research, whether it is diagnostic test or the medicine come, they are definitely costly because of the research involved in that. But still in India, things have improved a lot and are further improving. First of all, as the tests widely become available, their cost comes down because
mm,
India is a hugely populated country. So whatever test is the cost in abroad is there or the medicine cost abroad is there, it is much lower in India compared to abroad. And then health insurance is becoming more and more widely adopted. Even our government has now removed all GST on health insurance. Health insurance coverage is getting better and better. These facilities are reaching the tier 2 cities and their price is dropping. Then
mm,
these companies, these multinational companies, they run patient assistance programs for our patients, where patients from the lower economical strata, they get more assistance. For example, next free dose of a medicine or next
mm,
2 or 3 free dose of medicine, they are given with one medicine, which is a special initiative for our Indian patients. Depending on their income, the companies support these patients. And then we are getting more and more support groups. Our government is making a lot of efforts. For example, Pradhan Mantri, Ayushman Bharat, and Jan Arogya Yojanas. Then there are private support groups, Scan Kids. Then there are Red Cross. There are multiple charitable organizations that have come up. And now a new concept has come up, cloud funding, where they arrange funds through cloud platforms. That has also come up. So treatments are getting more and more affordable. Although newer medicines or newer tests, they are always costly because of the cost involved. But in India, very quickly the cost drops because the demand is huge for any new research that comes there.
okay, so thank you. So, anyways, we discussed about the treatment diagnosis, and you said that lymphoma and every whatever the type of blood cancer is curable, 100% confidence by seeing the evaluation of the treatment, everything. But still, there is a social impact, sir, psychosocial impact, the mental health. When the patient heard about the cancer, blood cancer is nothing but marna hai. That kind of wordings you always listen, because cancer is not only affecting that particular individual, it also affects the entire family when they heard about this blood cancer. Not so. What is your take on this, sir? So, how does you counsel your patient, and what are the psychological challenges he faces?
We agree that cancer is not 100% curable. The
Hmm.
best cancer cure rates are there in Hodgkin lymphomas or in diffuse large B cell non-Hodgkin lymphomas. They are to the tune of 60 to 70% at least. But definitely they are quite better numbers compared to the past years. So we need not get disheartened. So definitely the treatment and cure rate for cancer is rising, although every case is different. Every case is specific. And there are certain cases while the treatment is ongoing, a new drug becomes available that is even better and has better response rates, which was not earlier available, and patient survives on that. So this is our somewhat our destiny as well. Where you live, how are your finances, at what time you wasted the original cancer. But in general, your question is very pertinent that this entire diagnosis of cancer is itself a huge stress. It is a mental stress, financial stress, stress for the family members. And in blood cancers, patients receive so many blood products, sometimes blood cell transfusion, platelet transfusion. How to arrange so much blood products, how to bring the patient for weekly for chemotherapy sessions, and children, their studies should not get interrupted. Adults, they should not lose their jobs, and they should not erode their savings for the family. So these are very important questions that have a huge bearing. That's why we say that cancer is not a simple disease. It is a test of your mental strength, your financial system, your family support system, and even the healthcare system. Definitely, this diagnosis and treatment journey is quite long for most of the patients, and it's a overall test of all these aspects that I have discussed. But one should not get disheartened. You should not say कि मुझे कैंसर हो गया तो अब तो there is no hope, there is no cure, only death. ऐसा नहीं है. Things are improving rapidly, and hopefully, any patient who is diagnosed, we will find some kind of best treatment for them, which will be tailor-made, specifically, complexly designed for that patient. So there is hope. So we should not get disheartened just by the diagnosis of cancer. That is the important message of this all interview. If you take home this message that don't fear that the cancer is the warrant to death, ऐसा नहीं है. There are many advancements going on. Just visit your doctor without wasting your time. And if it is diagnosed, go to a regional cancer center and get it discussed with the best oncologists to plan your treatment in the right step-by-step way and carefully plan your support system. Children should not lose their education or their school studies for that. So our society should have such a system that बच्चे की पढ़ाई बीच में ना रुके, and our employers or government should make such regulations that their job should not be lost. And then family should come up, support the patient, and they should get adequate leave to spend time with the patient and bring them to the hospital. And then doctors have also to be very understanding. They have to uh, guide the patient, teach the patient, and so that they don't have to run to hospital again and again. And for minor problems, they can manage at home. So it is a entire ecosystem that needs to be created regarding this.
Sorry, my next question was that only what could be a strong, powerful message in this platform where we are talking about blood cancer awareness. Thank you, sir, for giving a strong, powerful message. And also, thank you very much for enlightening us and taking through us the whatever the steps included, like treatment, diagnosis, everything, sharing with us very politely, very patiently. I hope my audience, general audience, boost mean to say they are very confident, and also the excitement which you have created. Mean to say, blood cancer मतलब डरना नहीं है, because already treatment evaluation which you have explained, it really benefits our audience, sir. And thank you very much, sir. And thanks for your valuable time and your valuable presence on this Lighted Red Blood Cancer Awareness platform, sir. Thank you very much, sir. Thank
Most
you.
welcome. Most welcome.
Thank you,
Thank you.
sir.
Stay healthy.
Thank you, sir.